Good afternoon, everyone. I'm back with another video. And I want to talk about today the first time that I had a blood transfusion, correct? So if I go way back to the first time I ever had a blood transfusion, I would have to backtrack, back to when I was maybe 3 or 4 years old. But upon calling my mom to confirm exactly how old I was when I had my first transfusion, she confirmed to me that I was 4 years old when I had my first transfusion. And this was in the United States. I don't remember which hospital it was exactly, and my mom doesn't remember either. But if I'm not mistaken, it might have been in Bellevue Hospital. Because those are the only two hospitals where I have ever gotten transfusions. Being that I was only 4, right? I didn't have any emotional connection to what I was experiencing going through my first transfusion, correct? So upon contacting my mom again to ask her if she was concerned, nervous, or if she had any questions, her response was, right, that the amount of concern that was going through her body was indescribable, correct? I could only imagine how difficult it must have been for my mom, who at the time didn't know any English, correct? It was for her to go through that process, because being that I was only 4 and I didn't really have any understanding of what was really happening to me, besides the fact that I was in a hospital and they had to put IVs in my arms to get the blood transfusion going. I didn't really understand, and the only thing that I could base it off of was my mom's facial expressions at the time. She tried extremely hard to hide her emotions because her emotions weren't a very positive one, right? So she didn't want for me to be any more concerned than what I already was going through this process, correct? But I understood that there was an extreme amount of lack of communication to my mom from the doctors, correct? With a hint of anxiety. My mom was extremely anxious when she was going through that process of having to manage and having to deal with everything that she was managing and dealing with at the time. So it was very hard for her. I'm pretty sure that there were times and days and even nights where she cried to herself. She felt like she was helpless to her only son. And she felt like there was nothing that she could really do, except to see me lay in a bed with IVs on both arms, having one arm having fluids, IV fluids put in me, to help me hydrate, and then in the other arm have the blood transfusion actually going through my body, correct? But I want to focus this video more on parents and how parents can be of a support system to their children, a support system to a child who is going through this process, the process of having their first blood transfusion, or it might not even be their first. It might be their second or third or fourth, or they've already gone into this. You're already going through this process and it's already been a month or 2, maybe even a year. So I want to focus more on the parental aspect of this. And if there was any kind of parental advice that I can give parents out there, it would be that I would tell parents who are raising a child with sickle cell disease, I want them to know that there will be times as a parent that you're going to feel more pain than your own child. You're going to feel like like, oh my God, like I know he's in pain, but wow, this is hurting me as much or even more than what it's hurting him. Correct? The reason I say this is because going back to when I was in the pediatrics department, in the pediatric department side of my sickle cell disease treatment, there were countless days when my mother would cry more than what I would whenever I was in the emergency room due to a sickle cell crisis, which, by the way, is what my next video will be about. So I'm not going to go into too much details about what a sickle cell crisis is, because I want to leave that for a separate video. But moving forward, I remember a time when I was in my early teenage years when I experienced a sickle cell crisis so bad that the ER doctors gave me more than 25 milligrams of morphine to manage the pain, and it wasn't enough, right? That's how bad the pain was. So I ended up being hospitalized in the pain management floor of the hospital, which is meant to be an overnight stay thing only. It's only supposed to be an overnight stay because they want to watch me to manage the pain and make sure that in a time lapse of 24 hours, they have it under control. Correct? I'm sorry. But my pain lasted over 2 weeks. Right? It's a real bad pain crisis. And I had to be transferred to the regular hospitalization floor. And that's where the pain really took over my body so much that I had to be placed on what's called a PCA pump. Now, if I'm going to give you an example, or if I'm going to give you an understanding of what a PCA pump is or how it works, if I was going to define that to the best of my ability, I would say that it's just a pump which helps administer very strong pain medications like morphine and sometimes even Dilaudid as well. And the way that these medications are given is every 5 to 8 minutes, correct? Depending on how severe the pain crisis may be at the time. So every 5 to 8 minutes, there's a button that you can push to administer the pain medication to yourself. So you could do it yourself. And that way you don't have to like press the call button on the hospital bed and wait for hours for the nurse to be able to come to your room and only to ask you, you know, how can they help you? You know, because you'll wait for hours and for them to come, and they're not gonna come the first time that they come. They're not gonna be there with the medication that you need to ease your pain, because being that it's such it's a narcotic, it has to be signed off by a doctor, and sometimes it takes hours before they can get it signed off by a doctor. So the PCA pump, it alleviates all that stuff, and you don't have to go through the waiting process. All you have to do is wait 5 or 8 minutes. Honestly, it really depends on how the doctors put it or how they manage the machine itself. And you know, so the message I want to give parents in this section of my video, because again I want to focus on giving them some advice, is I just want to say that please, whatever happens to your child, stay calm and make sure your child doesn't notice your stress, right? That's very important. So it's important that your child doesn't notice your stress, because it can and it will make the child's pain episodes worse than imagined. And I say this from experience. There's been times in my life where I've had a pain crisis, and you know, I see my mom in the corner crying because she sees me in a hospital bed crying like if I'm gonna die because of this pain. And the reason she's crying is because she can't do anything. You know, there's nothing that she can do but sit there and watch her child experience this pain that is unimaginable. You know, it's a pain that it's undescribable unless you yourself have sickle cell disease. But I will, you know, later on as the days go by, I will make another video on, you know, a sickle cell crisis pain episode and what it entails and how it feels and the different characteristics and how it evolves and things of that nature. Um, so as I was saying, you know, staying calm and not letting your child notice the stress that you will be in can help alleviate the pain crisis, right? That's what I just stated. I know that there will come times when, as a parent, all you want to is wish that you were the one going through the pain, correct? But I want to be the first to admit that saying that statement that I just said is not going to make anything better. I know it sounds kind of harsh, and you might be thinking to yourself, wow, like this guy, he's a little bit too, a little too aggressive with the way he's talking. But, I have to be honest, and I have to be open, and I have to be 100% with my viewers. You're not going to make the pain better by wishing that you as the parent were the one going through the pain instead of your child. Unfortunately, that is something that only your child or the person that has sickle cell disease has to withstand themselves as an individual. It's like, if we could give some of that pain away to other people to make it easier on ourselves, believe me, I can think of a million people that would do that. But it's not a realistic thing. It's something that you, as a person with sickle cell disease, are going to have to know how to manage. I personally have an extremely high pain tolerance. So, whenever my pain is at an 8 for someone who doesn't have sickle cell, their pain could be a 10, and a 10 to me would be like maybe a 4 or 6, anywhere between 4 to 6 for someone who doesn't have sickle cell disease that is experiencing pain. But that's me as an individual. I'm not telling you, you gotta take this pain and be a man about it and not cry and not show that you're really in pain. That's an individual thing that you're gonna have to work on. And that is something that with my experiences and with my journey, I have learned how to develop. All right. So, before I finish, I just want to say that, the only way that you can, as a parent, there's only really 4 things that I can think of as a parent that you could do to help manage your child's sickle cell disease. Is, the first thing out of the 4 is go to all doctor's visits and share any concerns or new symptoms, right? So if you as a parent want to be the best support system for your child with sickle cell disease, just always be available. Always be available, always be willing to talk and ask, are you okay? Always ask, did you take your medications? Are you okay? Are you in pain? Is there anything that I can do? Is there anything that you would like to talk about that doesn't even have to do with sickle cell? Just try to find ways to take their minds off of the fact that they have sickle cell disease, which is a very, very bad disease that we would have to live with for the rest of our lives. Then the second thing is, make sure that your child takes all prescribed medications. Now, I want to make an emphasis on this one because from the ages of, I want to say 10 up until the ages of let me see. From the ages of 10 up until the ages of like my late teens, early 20s, I was not the best at taking my medications. There were times where I would go months, months upon months without taking my medication. And, I did it because I felt like I don't really need these pills. They're not gonna really do anything for me. It's not like they're gonna cure my sickle cell. I'm still gonna have sickle cell whether I take these pills or not. But again, speaking from experience, I want to say that taking your medications is one of the most easiest things to do to ease your sickle cell. I myself can testify that, there were times where I went a year, every single day for a year, taking every single one of my medications. And during that time, I went 4 months without needing blood transfusion. So it's very, very important. It's one of the most important things on this list that you can do as a parent and as a person with sickle cell disease is to take your medications. Always take your medications. If you need to write a chart and put it on your refrigerator, if you need to write it on your phone and write it on your reminders, if you need to have a friend, you can text a friend and say, hey, at this time, please text me saying take your medications, or the best person that I can think of to help you remind you to take your medications is your mom, honestly, or your mom or your dad. Personally, there were times when I was a teenager where my mom would beat me. I have to be honest. She would beat me and to make sure that I took my medications. And back then, when she would beat me, I would be mad at her and I would be upset. But now that I'm older, now that I'm 32 years old and I'm married and I have a child that I look over, I'm thankful for that. I'm grateful that she did that. I'm thankful and grateful that she would yell and hit me whenever I didn't take my medication. And after she did that, she then made sure I took it. So for that, I am extremely thankful of my mom for during that time. Now she doesn't have to do that because now I live on my own, with my wife and my stepchild. So, we don't have. She doesn't have to do that because I learned my lesson. I learned it the hard way, but I learned. The third one that I want to say is follow up with any recommended specialist to check for complications. Correct. So I have a bad habit of not having a primary care provider. Now, you're asking yourself, what is a primary care provider? I'm going to let you know. A primary care provider is it's a doctor that you go to where they can make sure that your heart is working properly, that your kidneys are okay, that your liver is fine, that your lungs are the way that they need to be. So a primary care provider does everything that a hematologist is not going to do. It's fine. And I'll be honest, this is something that I personally have to work on because I'm the type of person that I feel like the only kind of doctor that I need is a hematologist, and sometimes it can be true, but other times it doesn't, it's not how it works. It is crucial that we make sure that we have a primary care provider to help us with everything else that we need. I personally have had multiple surgeries in my life as well as multiple strokes, like I stated in my previous video. And it's important for me to make sure that I keep up with everything else in my body, not just my blood. Even though my blood is one of the most important things in my body in order to keep me alive, but everything else also needs to be healthy in order for my body to work as a unit, correct? So please, please, please follow up with any recommended specialist to check for complications, correct? So the last thing that I have on my list to talk about is help your child avoid pain crisis triggers as extreme temperatures, such as, right? So like, just two examples I wrote for you to help your child avoid crisis triggers is keep them away from extreme temperatures, right? So what do I mean by that? I mean, when it's wintertime, which is what we are in now, or well, it's fall, but it feels like it's almost winter, you have to make sure that you bundle up, that you keep yourself warm. Specifically your joints. Me as an individual, for me, my fingers are one of the parts, the first parts of my body that feels the cold as soon as I step out the door. I also have a bad habit of not liking to wear gloves. But I'm going to start to wear them because this winter might feel like it's going to be a strong one. So I want to emphasize, please make sure that you stay in warm temperatures, correct? Bundle up, when it's cold, when it's winter time and you're wearing jeans, make sure that you wear like leg warmers, or leggings or tights, or things of that nature, under your pants. Sometimes you could even wear shorts under your pants, to make sure you get that extra heat, to make sure that you don't trigger a crisis, correct? And then a big one is, of course, stress. I think that the biggest way to avoid having a sickle cell crisis is avoid stressful situations. I myself have an extremely bad tendency of putting myself in stressful situations. I've had multiple jobs in my life, in my whole entire lifetime. I've had multiple jobs. And they've all been categorized as stressful jobs. The last and most recent job that I had was a crisis intervention specialist. And that was one of my most stressful jobs because it was so stressful to the point where I ended up in the emergency room my first week of work. And, so I ended up having to move on from that job and, find something else. But staying away from stressful situations, or stress in general in your life is one of the most important things to help avoid a crisis pain episode. So with that, I am going to end this video. I will think of more topics and more things to talk about in regards to sickle cell. Please, 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 please watch my videos. I want them to be of educational purposes. There's so many things that I already have in my mind to speak about. And if I did it all in one shot, my videos would be 3-4 hours long. But with that being said, I'm going to end the video now and hope you guys enjoy it. And I'll see you guys next time. Have a good night.